Pain is a neurogenic or brain-driven phenomenon that's protective. Even though we feel pain in the tissue, all pain actually comes from the brain. Chronic pain, essentially what happens is the brain becomes wired to expect and to perpetuate that pain experience. Our clients come to us desperate. They feel like they've tried everything. The way it works is it acts like an artificial nerve that essentially mimic natural, no pain, no threat kind of nerve messages. To be able to see people get their lives back and get restored is a beautiful, beautiful thing.
Welcome to the Melanie Avalon Biohacking Podcast, where we meet the world's top experts to explore the secrets of health, mindset, longevity, and so much more. Are you ready to take charge of your existence and biohack your life? This show is for you. Please keep in mind, we're not dispensing medical advice and are not responsible for any outcomes you may experience from implementing the tactics lying herein. Are you ready? Let's do this. Welcome back to the Melanie Avalon Biohacking Podcast. Today's discussion with Brendon Lundberg is truly a revolutionary and fascinating perspective of what we consider to be pain. Reading his book and speaking with him really made me reconsider so many things that we know about pain and even really our perceptions of anything that we sense in our bodies, be it sensations, touch. And it really involves not so much the actual stimulus or what is occurring, but rather the message that is sent to the brain and how the brain interprets that message. We talk about this in the episode, but just consider something like phantom pain, where people feel pain from limbs, for example, that don't even exist anymore. So it's really, really fascinating. And we dive deep into the science of pain and also how it can be addressed through actually scrambling and changing up the neurological signals that are sent to the brain. This is so fascinating. Even if you don't personally experience chronic pain, I highly suggest still listening to this episode because it will really make you reevaluate your perception of so many things in life. I know it did for me. The show notes for today's episode will be at melanieavalon.com/pain. I'll put all the links and information there. I am a Himalaya partnered show, and if you follow the Melanie Avalon Biohacking Podcast in the Himalaya app, you will get early access to my podcast 24 hours in advance. So that's awesome. You can also join my exclusive Himalaya Plus community. You can get it completely free the first month using the code Melanie. And in that community, you can discuss episodes, request guests, and also you'll get some special monthly content sent straight from me. So definitely check that out. And also, if you'd like to engage with me more and my community, please join my Facebook group. That is Paleo OMAD Biohackers. Intermittent fasting plus real foods plus life. It's a wonderful world of diet and intermittent fasting and approaches to health and biohacking and all the things. So definitely jump in. I would love to see you there. And if you are enjoying these episodes, it would mean the absolute world. You have no idea and helps so much. If you have a moment to write a brief iTunes review, it just really, really helps with building credibility and bringing this podcast and the information therein to a larger audience. All right, so without further ado, please enjoy the show. Hi, friends. Welcome to the show today. So today I am here with Brendon Lundberg, and he has really brought an amazing new awareness and re-understanding of pain, acute pain, chronic pain, how it works in the body, and really how to address it through a really life-changing, revolutionary new method. So he's the author of Radiant Relief, A Case for a Better Solution to Chronic Pain. And I read that and it was fascinating and I absolutely loved it. And he's also the founder of Radiant Pain Relief Centers, which is actually implementing the techniques that he discusses in that book. So we're going to really go into the nitty-gritty of pain and how it works in the body. And I think people might be pretty surprised by Mr. Lundberg's findings. So thank you so much for being here, Brendon.
Hi, Melanie. Yeah, honored. Thank you.
So I thought to start things off, if you could just tell listeners a little bit about your history, how you came to be involved with the whole science of pain, everything that led to where you are today.
Yeah, awesome. My background is healthcare related business. I'm not a clinician, but I've spent my entire career in healthcare for the most part. And actually, even prior to that, I grew up in healthcare. My dad was the CEO of hospitals as a kid, so I've kind of been in and around doctors and healthcare for a very long time. Through a variety of circumstances, found an opportunity probably around 2010 or so to devote time and resource to promoting a technology that's now central to our business to address chronic pain. And I approached it from a business standpoint, although with some personal experience because I'm a chronic pain sufferer. I have been since I was a teenager. My wife had gone through a fairly complicated health journey of her own, which kind of helped inform what we do. And I spent a few years trying to sell this technology to doctors and found that in most cases, they didn't understand it. There was often an economic disincentive for them to migrate away from the therapies they were currently promoting and pursuing and recommending to this. And so I stepped away from that and thought, well, this is interesting. This technology seems to be pretty effective and it seems very promising. So maybe it's not a matter of efficacy, but a matter of commercialization and just conceptualize a different business concept. And in that pursuit, really had to get deeper in my own understanding and our team's understanding about modern pain science, which is really quite fascinating because even though we feel pain in the tissue, all pain actually comes from the brain. And chronic pain is actually, in most cases, not a tissue problem at all, but really a problem of the brain. So I'm excited to talk a little bit more about that. And hopefully, if any of your listeners out there are dealing with pain or someone they know, this will be valuable information for them.
Yeah, I was so fascinated by that, which you discussed right in the beginning of the book, that our understanding of pain may not be what we've been led to believe. So would you like to go a little bit deeper into that? I guess looking at the traditional model of pain, how we traditionally see pain, and this new idea that actually all pain is in the brain?
Yeah, absolutely. Well, first of all, pain is a very human experience. There's not a single person that's ever lived on earth that hasn't experienced pain in some way. And so, we all have a personal relationship with it as well. And generally speaking, that experience is a negative one. And, it hurts, it's uncomfortable. And so none of us like it. We want to mask it or minimize it as quickly as possible and get on with our lives. But pain is a neurogenic or brain-driven phenomenon that's protective. In the short term, in acute pain, it's pretty clear why we have pain, and it's pretty clear that it is protective. For example, if we have our hand on the hot stove, it's clear why our hand hurts. Or if we, sprained an ankle or broken a bone. In fact, I fell about a week and a half ago, and I have a sprained knee that I've been nursing back to health over the last few weeks. And feeling that pain is uncomfortable, but it's serving a protective function. It's saying, hey, you've injured yourself, or there's cancer growing in your tissue, or you're doing something that has the ability that may cause consequences to your ability to stay functional, and we want to protect you from that, avoid it in the future, learn from it, and let it heal. So in the short term, pain is a neurogenic or brain-driven phenomenon that keeps us alive. And it's important, and I'll come back to this, but it's important to understand that that's the nervous system's primary job, is survival. It's to keep us alive. So it's clear that in the short term, that pain experience is one in which the body is, trying to protect us. The brain is trying to protect us from something that might make it harder for us to stay alive. And then in chronic pain, essentially what happens is the brain becomes wired to expect and to perpetuate that pain experience. And so if we think back to our caveman ancestors, when they were injured or hurt, they realized pretty quickly that if they drank alcohol or took product like opium, that they could mask the pain and feel better. And so industry has really been kind of born out of this analgesic approach via biochemicals. And, opioids are not much different than opium. They're an artificial derivative of the same kind of chemical compound. And so those things are very effective at masking the problem, so effective, in fact, that it hasn't really created a need for us to understand pain at a deeper level until all of a sudden now in our modern world, we have not only an enormous pain problem. In the United States alone, there's over 100 million people who suffer from chronic pain, which is more than cancer, diabetes, and cardiovascular disease combined. So it's staggering numbers despite the advances that we made in healthcare. And we have, hundreds of thousands, if not millions of people addicted to opioids. So it's been the opioid crisis that's caused us to take pause and step back and go, wait a second, maybe it's time for better understanding, and from that better understanding, better approaches to pain. But it is all coming from the brain. That's what modern science makes clear for sure.
Yeah, and I think that's reassuring in a way, what you started with by saying, pain, it's not a bad thing. Like, it's there to protect us. So that's really motivating to know that it's not something we need to necessarily, stop completely. We just need to, I guess, address, in the acute situations, it's there for a purpose, but then in the chronic situations, which is obviously very different, that there is something awry with that. So looking more at chronic pain, You were talking about how the brain begins to expect the pain. Could you elaborate a little bit more on that process? So with chronic pain, what's actually going on? Why are we constantly feeling pain in whatever area that we have the chronic pain?
Yeah, so I think a simple way to understand this, and we use this as an analogy for many of our clients, if you think about phantom pain, for example, like a part of the body's been amputated or lost in an accident and it no longer exists. But many people that experience this still feel sensitivity and particularly explicit pain like let's say in a foot that no longer exists. So why is that? It's clearly not a tissue problem because the tissue is removed and the nerves are gone. So why is the pain perpetuating? Well, I'll explain that in a second, but essentially, all chronic pain is kind of like phantom pain, like it's existing really regardless of what's happening in the tissue. And in fact, there are a number of studies that show that a high percentage of the population, in fact, close to 80 to 90% as we get a segment of older population, has tissue abnormality that we would think would cause pain, but it doesn't. So it's asymptomatic. For example, you could go to Central Park in New York City, you could take 1,000 people, and between 60 and 80% of those people will have arthritis, they'll have herniated disc, they'll have torn meniscus, they'll have some sort of pathology in their tissue that we think would cause pain, but it isn't for them. And conversely, you could take 1,000 pain sufferers and image them, and you're going to find a high presentation of people who don't have a correlated presentation of tissue abnormality. So there's really a disconnect. And again, pain is a phenomenon that's driven by our brain, by our nervous system to protect us. And in chronic pain, the brain becomes wired to expect it. So what's happening essentially is the nervous system's primary job above everything else is survival. And so again, we think of pain as a protective function. It's clear that if we've injured ourselves, we want to know that so that we can take necessary precautions to let that tissue heal, that we can learn from it, we can avoid it. And if we're in a circumstance in which, particularly thinking of us kind of evolutionarily, if we think of our caveman ancestors, if they were injured, they would need to know that so that they could plan appropriately to avoid danger, to flee in the face of some sort of threat, or just to be able to function differently so that they could hunt and gather food and keep themselves fed. So essentially, the nervous system, because its job is to keep us alive, it is always working to identify what are threats to its ability to keep us alive, and it records those and it remembers those. And we think of pain very cause and effect, and we think of it meaning that something is wrong. But a more appropriate analogy, which I made in the book, is really kind of probably credit card debt. Do you remember that part, Melanie? I could go into it in detail if you'd like.
Yes, I do. I thought it was a really great analogy. So go for it.
Yeah. Okay. So if we get a credit card and let's say we have like a $3,000 limit, we start using that credit card to buy gas and groceries and school supplies for our kids, we're racking up charges to that account. As long as we pay the bank at least the minimum payment, but ideally pay the bank off every month, that we have access to this credit and it's supposed to work like it should. So we can think of our nervous system as cataloging and charging events that it perceives as threats to our ability to stay alive, much like charges to a credit card. And again, if we're healthy, if we're sleeping well, we're getting good nutrition and we're moving and we're avoiding, a lot of compounding and chronic stress, then our nervous system works like it's supposed to and it kind of flushes those things away. Well, most of us don't. We live in a world that's high stress. Most of us aren't as healthy as we probably should be in terms of, weight control. We eat maybe bad. We have chronically disrupted sleep, et cetera, et cetera. And so that makes it easier for our bodies to not flush off or resolve those charges to our nervous system account, if you will. And so now, all of a sudden, if we're carrying a balance, problems can occur. So if we go back to the credit card analogy, let's say we have a balance of $1,500 or something on a $3,000 limit. Well, that's fine until the car breaks down. And now all of a sudden we have a $1,700 car repair bill for a new transmission, but we only have $1,500 of available credit. Metaphorically, this is painful because we have a big bill. And now we may be, or probably in this case, probably over the limit. So maybe there's over limit fees. And if we're relying upon that credit card to get to work, to buy gas or maybe to pay utilities or to buy food for our families because we don't get paid for another 2 weeks, then the circumstance around this whole the situation make this one event of the car breaking down even more painful. And if we didn't have the charges on the card, we could have absorbed that charge, no problem, and been on our lives. And so we think of it, well, it's because of this card that I'm now in this circumstance, this car repair. But really, it's an aggregation of many things. And the same is true with our nervous system, which is why you have somebody that maybe has an injury and that injury doesn't heal like it's supposed to, and it becomes this kind of cascading problem. Or like, for example, in fibromyalgia, there's not really a clear cause. It's just kind of spontaneous pain that's beginning to develop. And so it's kind of, there's been an aggregation of threat experience on our nervous system. And, we think of it as a bad thing. So we quickly just want to mask it. Well, masking it with a drug is not too dissimilar to trying to deal with our credit card debt by drinking a 6-pack of beer. We might feel better in the moment. We mask the problem, but we haven't resolved what's been the underlying causation to that problem. And in fact, if we put that 6-pack of beer on our credit card, we may have actually been making it worse. And so that's really what we're seeing happen with pain sufferers is been a lack of education and understanding around the multi-factors that lead into a chronic pain situation. And we have a social expectation and really kind of a medical establishment that promotes a quick fix of popping a pill that really is just frankly exacerbated the problem long-term for all of us.
Yeah, that was one of the things that really stuck with me when you were talking about the credit card debt and talking about how it explains why some people seemingly can handle stress and pain, I guess on a case-by-case basis, and they're paying off their credit card debt in a way, whereas other people, it's like the tipping point and then they just crash and burn. And that might be because, slowly they were accumulating this debt. And then when it hit the tipping point, everything just goes haywire.
Absolutely. Yeah. I mean, if you think about it in these terms, like let's say, well, for example, myself, I fell 2 weeks ago. I was trying to kill a spider on the ceiling and I fell off the stool. It moved, it shifted, and I landed on my knee and I tweaked my knee out. Okay. So immediately it hurt. And I started thinking, holy cow, like what if I can't work? What if I can't get around to, handle the things I need to do? I have some travel upcoming for some investor events and things like that. That will impact the business. And so you start thinking about these things. And that's what happens for people is like, there's an event, but the event it's more than the event. And then there's a common term that's often used in pain management called catastrophizing the pain. It begins to take on a life of its own. It becomes more than just an event itself. It becomes an impact to so many other aspects. And then because most of us are already, stressed and probably not in the best shape we should be, we're not sleeping well, we're probably not minding our nutrition like we should be, we're already in a compromised state. And then this obviously puts us past that tipping point. And the medications, inevitably, even if they're helping to mask the pain, they inevitably over time make us worse because even the over-the-counter meds can disrupt normal gut functioning, kidney functioning, liver functioning. And, the opioids are certainly even worse. They're certainly very constipating. And so, there's further compromisation or compromise to our ability to absorb nutrition and to eliminate waste, which makes weight control even harder because of the pain or the medications or both. Our sleep is probably more disrupted, and that exacerbates problems. I mean, the comorbidities or health problems that come from chronically disrupted sleep are well documented and enormous, from cognitive decline to, increased risk for diabetes and all sorts of other problems. So if you're not sleeping and the pain and maybe the medications, you have, an emotional toll, kind of a compounding kind of cognitive impact that takes place. And so it makes it harder to feel connected to the activities, to the relationships, to the hobbies, to the work, the things that make us feel the most productive and happy and joyful. And then that adds to it. And then we start to see, oh my gosh, like I'm not able to work like I want to, or, engage in the relationships like I want to, or make life fulfilling like it once was. And so this has a compounding effect that over years or decades makes pain very, very, very complicated. In mass, it's pretty hard to think about how do we solve this problem. And again, because we're conditioned to think of pills, inevitably by the time we see patients into our clinic after years or decades, they're on a cocktail of medications and they're pretty complicated and many times depressed and anxious. And, it's just grown into this, problem that's so much bigger than just a single pain event.
Yeah. And it's so fascinating that our perception of pain and our brain's interpretation of what that pain means for our life, that actually can make it worse. I really identify with this and resonate with this, not on a pain perspective, but with stress. Like I know for me personally, I used to see myself in the past as thriving on stress, which I don't know if that's good or bad. We can make an argument either way, but I didn't see stress really as a negative. And I don't feel like I was accumulating a debt in a way with stress because I just handled it on like a case-by-case basis. And I was like, oh, I'll come out all the stronger. And then when I started overanalyzing stress and thinking about how, oh no, this stress is hurting me, seeing it as like a chronic stress, I started worrying about it. And I think, and again, it's not pain, it's stress, but I think my new interpretation of it made it much, much worse in the long run. Like there's such a difference between feeling capable and dealing with a situation versus worrying about it, ruminating, and everything that comes from that. So I guess with the pain, it's pretty interesting because we're making the argument that pain is all in the brain to begin with, and then B, our brains can make it even worse by reflecting on it.
Yeah, absolutely. And it's not just a matter of even just reflecting on it, although that's part of it, because, when I talk about in the brain, I mean, the brain has multiple parts of its anatomy, right? We have the brain stem, we have the amygdala, we have the cerebellum, the frontal cortex. I mean, there's all sorts of different anatomy functions of the brain, and they have different purposes. Our heart rate and our breathing are driven by our brain. We don't think of them as driven by the brain, but they're not driven by we're not having to consciously think about those things. They're just done. And pain is kind of the same way. So it's not necessarily that it's something that they think about, but if they do think about it, it can impact it, make it worse, or frankly, make it better. I mean, there's definitely studies that show meditation can significantly improve a pain experience to profound levels. But when we have chronic pain or chronic stress, it changes also the chemical components of our brain and the bodies. And if we have cortisol floating through our bodies, biochemically, we begin to change. And so, it's not just I want to make clear this is not like a psychosomatic thing and somebody's, allowing or willing the pain to exist because they're, have negative thought patterns or whatever. It's not that way. But at the same time, our thought process and our approach to it from a cognitive standpoint can significantly impact the pain experience to a pretty profound level, and stress too. I mean, meditation obviously is very, very effective at helping to reduce the overall stress burden that many of us feel on a daily basis.
So it seems to be pretty self-perpetuating once you get in the loop of it.
Yeah, 100%. Absolutely. And again, I think the drugs are an effective short-term remedy, but inevitably they end up making it worse long-term because they disrupt the other body systems and functions that really we need to have working in order for us to be healthy and thriving, for sure.
So before we go into the new way of understanding pain and how you address it now, so quick question to clarify. So with chronic pain, is there literally no stimulus to create the moments when the pain arises, or what starts the brain to keep feeling the pain? What is the cause and effect there?
Well, there could be an injury that caused it initially, or a series of injuries is likely as well. Or it could be a combination of many other things that the nervous system has started to change. And it begins to be basically hypersensitive. So when the brain is expecting pain, or it's hypersensitive to the fact that it's now at the limit of what it's really capable to tolerate and keep functioning, it begins to change physiologically, and it starts to interpret normal sensory input like touch, like even a light caress or movement or laying down to go to sleep as potential threats. And so it becomes a maladapted response to an otherwise healthy system. And the result is it becomes kind of a feedback loop. So if the brain is expecting pain, the body's looking for pain, then it's experiencing more pain. So it's kind of like that old adage that we don't see the world as the world is, we see the world as we are. And it's true, because we're a factor of our environment and our upbringing and our genetics and cultural influences and on and on and on. And the same is true with pain. We don't feel pain as pain is, we feel pain as we are. And so as our nervous systems become conditioned from all the same things that I just talked about, from genetics to cultural expectations, to our own education and understanding about it, then we interpret the pain through that filter of expectation and belief, both cognitively, consciously and unconsciously, subconsciously in our deep reptilian brain. And so it's pretty complicated, but the nervous system does change and it starts to interpret more things as potential threats. And inevitably, for our chronic pain sufferers, we find that there's oftentimes an underlying disconnect from one of the sensory systems and the brain. For example, so because the nervous system's job is to keep us alive, it has to know what are the threats in our environment that potentially could threaten its ability to keep us alive. So that's our eyes help us see the landscape to know and identify in our surroundings what are potential threats to us. Our vestibular system, which is the organs of our inner ear, those keep us balanced and upright and agile and able to move through our environment safely and to avoid danger and to respond quickly to threats. Our touching feeling senses help us know if we're standing on stable ground or rocky or unstable ground, or if we're standing in a frozen river that could be potentially, causing frostbite or damage to our tissue, or standing on hot coals or something else. And so the touching feeling senses. And then the last, which is known as kind of proprioception or our orientation in space, all of these things are gathering information input to the brain to give us a sense of safety. Well, that information is filtered through our brain's experiences that it's learned over time. And so because of that, it could potentially have a misperception of what might be a threat or not. But what happens for a lot of our chronic pain sufferers is we find that one of those systems or multiple of those systems and or the brain aren't gathering or interpreting or processing that information in the appropriate way. For example, it's not uncommon to see some of our pain sufferers that if you were to caress their left forearm and into their right hand, and then do the same thing to their right forearm and into their right hand, they have a different sensory experience. Like it feels a little bit differently. Why that happens, it's multifactorial. Or again, going back to the phantom pain, we used to think that phantom pain happened because the tissue was, damaged and that the nerves were cut. And certainly that was a part of it. But if we think of it under this modern understanding of pain and the input of sensory information to give the brain a sense of safety, well, that if it's been the foot that's been amputated or lost in an accident, that foot that used to gather information about where I'm standing on stable ground or unstable ground, or in a bucket of ice or in fire or something like that, that information is no longer being transmitted to the brain. And so the brain's response is, hey, Mr. and Mrs. Human, I can't give you a full sense of safety. I don't know what's happening in this part of your body. So what I'm going to do, just like they had on the hot stove, is I'm going to generate a pain experience, because pain is something that gets our attention more than just about anything else. It's very alarming, right? We don't like it. And it's going to cause us to take pause and to try to give our nervous system a sense of input as to what's going on in this area of the body, so that it knows what it needs to do to keep us safe and keep us alive.
That is so fascinating. So basically any of these potential stimuli can come in, and then our brain overreacts and freaks out, to put it in very casual terminology. So when I was reading the book and you started discussing that concept, that it sounded to me like something I had recently been looking into, which was DNRS, which standed for Dynamic Neural Retraining System. I had actually just looked into that a few weeks prior to reading your book. And then you even said in the book that your new re-understanding of pain actually started in part when your wife used DNRS to heal her, her chronic pain issues?
She didn't have chronic pain, but she had anxiety and depression and, a lot of other conditions. She was diagnosed with Hashimoto's disease, with chronic inflammatory response syndrome. And she is a yoga instructor. She's super fit. She's super knowledgeable about, anatomy and physiology and mindset and mindfulness and meditation. She has the ability to create calm, even when, so from an outsider's perspective, nobody would really know she was dealing with all these things. We sought out care from allopathic to the gamut of alternative medicine. She was gluten-free for over a decade or close to a decade, certainly mindful of her diet and her overall sense of health. And yet none of these things were resolving her conditions. And she's like, why am I, how come nobody can help me understand this? And finally, when she heard about DNRS and went through that process, essentially, which is brain retraining, it allowed her nervous system, again, because pain and fight or flight or anxiety, these are appropriate biologic conditions that are protective in nature. But what happens is, in our modern world, what is a threat or perceived threat is not the same as it was when we were cavemen. And so, sometimes these things become maladapted. They get, essentially, for lack of a better term, they get stuck in the on switch, and they get perpetuating a phenomenon in our body that becomes kind of, again, like pain, like a feedback loop. And so when we expect anxiety or we expect pain, then the nervous system is gathering information that supports that in an effort to keep us safe and keep us alive. But really, it's not serving us in a protective way. And it's really kind of a maladapted response in the brain to what is otherwise a healthy biologic system. So DNRS allows people to kind of retrain their brain and ease this kind of limbic response. And we do much the same thing through our therapy at Radiant. Yeah.
Yeah. So with that DNRS, there's no equipment involved or anything like that. It's all the practices that you do to, put in the work, the exercise to retrain your brain. But so moving on from that, would you like to talk a little bit about where you went from there with that new understanding. You talked about something called Scrambler therapy in the book.
Well, Scrambler therapy actually, yeah, I found out about it before I understood pain. And again, I saw an opportunity to promote this technology to doctors, and I thought it was going to be an instant home run. The pain problem is significant and was significantly known at that time, although the opioid addiction epidemic hadn't made it quite as urgent as we now kind of perceive it to be. And I spent time and my own money and resources going out to doctors and trying to promote and sell them this device. And I found that in many cases, they just didn't understand it because, most doctors are trained literally, and they get very little pain education in medical school or in their professional training. And what they get is often limited to acute pain, not to chronic pain. And most of it is based upon pain science that was published in the 1960s. So they lag behind in initial education because pain is not terminal in most cases by itself. They get very little continuing medical education around pain. And what they get is often funded by the drug companies. So, in honesty, it's probably not the most neutral. It's a little bit biased towards that drug company's product and their perspective on managing the problem. And so because of this, there's a lag in understanding amongst the medical establishment about pain. And then on top of that, you have a cultural misunderstanding because we all experience pain. We think it's, always a bad thing. We think it's a tissue problem that we shouldn't move, that we should, in the mask it, avoid, all those types of things as we talked about. So you have a compounding of both of those things. And then, like any industry, you have economic drivers. And so, industry, generally speaking, doesn't want to disrupt itself. And so, there's a hard time taking an established and large infrastructure of industry like you have in healthcare and getting them to open their mind about new science and then to change science. So, if we think about this, like, we once believed that the world was flat. If there's industry built around this idea that the world is flat, then that industry doesn't want to disrupt itself to accommodate a new paradigm because it means taking money out of their own pocket. And I don't mean this necessarily in a derogative way with doctors specifically. I think that they're well-intentioned, but those are the circumstances that surround it. And, many doctors are just they're so busy. They're just doing the best they can to try to meet the client needs they have. And what that often means, and this is oftentimes driven by insurance mandate, is what's the fastest way to get you something that's going to manage your symptoms to get you out of my office? And that's typically a drug. And so we see, the drug industry grown and promoted by insurance companies. And, culturally, we have an expectation that there's a pill for that and a pill for this. And so we want the quick fix of the pill. And it really hasn't been till we go, holy cow. In 2017, we had 72,000 people in the United States die of opioid overdoses. That doesn't include the hundreds of thousands, if not millions, who are addicted or have become addicted and then chosen to go out when their doctors have said no more or their prescription isn't sufficient for them, go out on the street and try to buy it and find that heroin is cheaper. It has just turned into this whole cultural and social impact situation because we've been conditioned to just want to pop a pill. So you have a lot of industry drivers that have prevented, adoption and innovation the way that we probably need to, and certainly be responsive to the science. This is not science that I've concocted or created. This is science that's emerged independently from a variety of sources, but it just takes some time to integrate and matriculate into the body of medical education and cultural understanding. And that dissemination is limited or delayed further because of industry drivers.
Yeah, that was definitely a large part of the book, was explaining all of the obstacles that we face with modern society as far as how it currently addresses pain and then why it's so difficult to introduce these new methods. And I think that's really important for readers and listeners to understand, because they may think, oh, if there is this solution to chronic pain, why have we not heard about it? Why is nobody using it? And so just addressing that in detail really explains that basically the system as it is right now is not receptive to this new paradigm.
Yeah, you're exactly right. And again, I think people are well-intentioned. It's just that, when you're trained in a certain way and all of a sudden new information comes along to you, you have two choices. You can unbundle and break down your current training and education and perspective on something, or you can say, that sounds too good to be true. Yeah, thanks, but no thanks, or I'll wait and see. And that's what happens in most cases. And again, I think particularly doctors are well-intentioned. They want to do no harm. They want to serve their clients. But because of the factors of education and economic reality and life reality, it's just makes it really hard to disrupt and change. I mean, that's true of any industry, but it's particularly true of healthcare because of the level of education that the professionals and the industry drivers themselves kind of have gone through. And so, but if you think about any industry, I mean, you think about Airbnb, for example. Airbnb has obviously changed the way that many of us stay when we travel, but it wasn't done by, wasn't created by the Hilton Corporation. It was done by some other outside perspective, or Lyft or Uber. I mean, these weren't driven by the taxi cab companies. They were driven by outside perspectives that said, I can see the opportunity in the market different. And fortunately, I'm not handcuffed or constrained to those same economic realities. Therefore, I have an incentive to want to try to shake things up and disrupt that. And that's really how we're approaching it from Radiant's standpoint.
Yeah, the analogy I always think in my head, I always come to health and everything from a food perspective. That's my background. So I have a book about paleo and intermittent fasting and using all of that to address chronic health issues. And that's always what I'm thinking about as well, is how to, change the current system, or where those forces need to come from that can create that revolutionary change. And that's really interesting. I never thought about that with the Uber and the Lyft. I'm always thinking about it from like the grocery store perspective.
Well, the grocery store perspective is super important. And I just want to talk about that because I have many colleagues and friends who are functional medicine doctors. They're naturopathic doctors. They're focused on nutrition and interventions through changing the biochemistry via what we're eating. And that's so important. And a couple of things I want to say about that. I heard Congressman Tim Ryan last year speak at JJ Virgin's MindShare conference. And, he and Mark Hyman, Dr. Mark Hyman, who's head of functional medicine at Cleveland Clinic, they talked about how, from a food standpoint, you had industry drivers changing food science. You had studies funded by sugar growers and wheat growers and grain growers and things like that, and it changed the science. I mean, frankly, it skewed the science because there was funded with specific purpose in mind. They had lobbyists that changed how we approach this from a funding standpoint, from an investment standpoint as a nation to support these types of crop production. And it changed the presentation of food science as a whole. I mean, you think about what probably you and I were taught in school in this food pyramid that had this giant grain structure at the base, and increasingly to the top, finally you get to fat. Well, it's really an understanding of, if we kind of reverse that and have a higher fat diet, lower grains, intermittent fasting, things like that, that we can actually get healthier, but we haven't been conditioned that way. Society hasn't been taught that. And in fact, in many cases, the opposite. And the same is really true with pain. The other thing I think that's important to understand about pain and food is that absolutely, I mean, eating good nutrition is a way to ease the body's perception of pain, to give it the fundamental building blocks it needs for healthy, cellular functioning and tissue building and all those things. But when you are in excruciating pain, you don't care about that. You just want to find pleasure or ease yourself in any way you can. And I know many pain sufferers who their only pleasure in life is to drink a Coke or to eat a hamburger or to do some things that maybe aren't the best dietary choices. And they're just doing it because it's the one subtle thing that they can do to find some pleasure in the day. And then again, the drugs are disrupting that, because if the body's not absorbing nutrition or eliminating waste, it almost doesn't matter what's going into it. We're not going to be able to process that the way that we need to really be healthy.
Hi, friends. I hope you're enjoying this interview with Brendon Lundberg. I talk about this a little bit later in the episode, but besides Brendon's amazing findings surrounding pain, another super effective method for addressing pain is with red light, and specifically near-infrared therapy. It's clinically studied and honestly a game changer. Basically, red light and near-infrared works on the level of the cell to change how the cell's mitochondria generate energy. And when your mitochondria are properly generating energy, everything just sort of works better. And when it comes specifically to pain and inflammation, a myriad of trials have shown just how effective red and near-infrared therapy can be in combating all types of pain and inflammation, including those from acute injuries, as well as chronic pain and chronic degenerative disease. There's likely a lot of mechanisms going on, but a few of them is that this light therapy can actually downregulate the body's inflammatory response, which is often a mechanism behind the feelings of pain in the first place, like we discussed in this episode. One study actually found red light therapy relieved pain in patients with arthritis by 70%. So that's pretty effective. Red light can also increase blood flow and circulation so that the body receives the nutrients and oxygen it needs for growth and repair. It can stimulate tissue repair and healing, including that of nerve cells, and it can even modulate wound healing by influencing mast cells, macrophages, and neutrophils. Studies have shown it is highly, highly effective for combating muscle pain after exercise, and it truly holds a host of benefits when it comes to pain. Of course, it has a million other benefits as well. Things like revitalizing your skin, targeted fat burning. Yes, I said it, targeted fat burning. Supporting the immune system, boosting mood, regulating your circadian rhythm, and so much more. I am such a fan of red and near-infrared therapy. The only catch, because there's always a catch, is that these specific wavelengths are key. You actually have to have wavelengths in a very, very tight range to achieve these benefits, and most of the red light and near-infrared products on the market honestly don't provide those specific wavelengths. They tend to provide like a general range, which may or may not be therapeutic, and you just really don't know what you're getting. That's why I wholeheartedly love, use, and adore Joovv. They make red light and near-infrared therapy devices that are made to produce those specific wavelengths you need to experience pain relief and all the other benefits I discussed. They have so many different sizes and models, so you can really find what works for you. For example, if you have pain just, in a small place, you can get the Joovv Go, which is a handheld device. It's available in either red or near-infrared. If you're using it to address pain, I suggest the near-infrared. And then you could spot treat those painful areas. For larger areas, and if you want the benefits of both red light and near-infrared, you'll want to start with at least the mini. That's how I started, and I adore it. And of course, you can go up from there. For full body, you're going to want to start with the Solo. I've got that as well. It's awesome. And you can go even bigger and bigger from there. And they are modular, and you can connect them together. So you can, start with a unit and add on more and more as needed. And I do have special things for you with that. So if you go to joovv.com/MelanieAvalon and use the code MelanieAvalon, you can pick a free gift from Joovv. And also, if you use that link with that code and forward your proof of purchase to podcast@MelanieAvalon.com, I'll send you a signed copy of my book, What When Wine? Lose weight and feel great with paleo-style meals, intermittent fasting, and wine. All right, now back to the show. I want to say thank you because I really feel like you have completely changed my perception, or you've given me a much more nuanced perception of pain, because and honestly, until I read your book, I was thinking, all pain in theory could be addressed by an anti-inflammatory diet, because if we get rid of all inflammation, then there won't be any pain stimulus going on. But reading your book, I've realized, there is, this other aspect to it as far as, the interpretation of pain. And, it might not all be addressable necessarily through dietary means, which I don't know if I was saying that it could be completely addressed that way, but that was sort of my thinking. So just want to thank you for giving me a much more nuanced perspective now of pain, especially personally. My mom has a lot of chronic pain issues, and she always had them. She's had them for ever since I can remember. In my pipe dream version, I was thinking, if she just, changed her diet and removed all inflammatory compounds, her pain might magically go away. A, that's probably not true. And B, it's like you were talking about, it's very difficult to follow for a lot of people what even is a perfect diet, but it is really hard to implement, dietary change consistently and to the level that might even be needed to see a significant reduction in pain. So that brings us to this new system that you have developed and working with, which, like I mentioned, the Scrambler therapy, which it's sort of based on, but you have a new implementation of that. So would you like to talk a little bit about, I guess, first Scrambler therapy, and then what it is, and then what you're doing with that now with your radiant relief?
Yeah, absolutely. So basically, the Scrambler therapy is a medical technology that was invented in Italy by a biophysicist there, was taken through the FDA. It has FDA clearance, but when it was taken through the FDA, not by us, but by a previous company, it was predicated on something called a TENS unit, which probably many of your listeners have heard of or used. The TENS has been around probably since the 1950s, maybe even earlier.
I have one of those units because, like I said, I don't have chronic pain, but I have digestive issues, and I think I have a hyper-aware sensation revolving that, which we can talk about that maybe a little bit at the end, just because I selfishly want to know your opinion on it. Similar concept as far as overanalyzing stimulus and always feeling this feeling, which is not a pain feeling, but it's a very unpleasant feeling that creates distress for me. So a TENS unit was something I had tried for that before, but you talk about in the book how this is not the same thing as TENS.
No, it's not. It's not the same thing as TENS. A TENS basically creates an electrical stimulation that kind of masks the pain. So, for example, just to break it down very simply, if I whack my hand on the table and my hand starts to hurt, if I rub my hand, then my brain is getting a different sensory experience. It's feeling the rubbing sensation. So that rubbing sensation can kind of mask the pain sensation that it was feeling just moments before. And so that's essentially how a TENS unit works. It creates an electrical stimulation that kind of distracts the brain and can kind of ease the pain experience. And it works, fairly effectively while it's turned on, but as soon as you turn it off, the efficacy wanes. But because this technology was predicated on that type of technology, on a TENS unit, it's lagged behind in adoption and understanding, again, in the context of, most doctors being trained in old science, but insurance hasn't really caught up to this yet at this point is where I'm headed with this. So there's an economic, disincentive for most doctors to be able to effectively integrate it into their clinic.
So to clarify for listeners before we move on, basically with TENS unit, it sounds like if chronic pain is one person yelling at you, then a TENS unit, is it kind of like somebody else coming and talking at the same time so you get kind of distracted and don't really pay attention to the yelling?
Well, that's a great analogy. Yeah, that's a good analogy.
Okay, so that's TENS.
Yeah, but if that person stops talking to you, the talking may or may not fully distract the yelling at you as you the term you used, and as soon as they stop, then it's right back to just where it was, and that's essentially what happens with a TENS unit. Yeah, that's a great analogy.
So the yelling is still there.
Yeah,
the original yelling, you're just kind of distracted from it.
Right, exactly. So rather than trying to do that or to give somebody a pill, which inevitably changes the biochemistry of the body, results in side effects and addiction, or surgically trying to repair it, which is probably not the problem. Again, and when you understand the fact that, pain and tissue abnormality are not actually correlated the way that we think that they are and are kind of conditioned to believe that they are, surgical interventions may or may not resolve the pain. In fact, there's a diagnosis code because it's such a common thing, failed back surgery syndrome, where somebody's had, quote unquote, a herniated disc or some sort of stenosis or some sort of abnormality in the tissue, and it's tried to be repaired surgically. And the doctors go, Miss Jones, your MRI looks perfect. We did a great job. And then Miss Jones is saying, I'm in just as much or worse pain. That happens more than 50% of the time following back surgery. So anyway, my point is we don't go through these difficult interventions. We use a Scrambler therapy. The way it works is it acts like an artificial nerve. It generates a dynamic set of artificial nerve impulses that essentially mimic natural, no pain or no threat kind of nerve messages. We attach electrodes on the skin in healthy tissue, so not where it's painful, but near that area. And then we turn the device on and it generates this message. It's sent through the wires of the system up through the periphery of the body, through the central nervous system, specifically through what's called the C fibers of the nervous system, which is where chronic pain is transmitted. The brain receives that information. It interprets it as kind of a self-generated endogenous nerve message, and it begins to ease the pain response. The reason the technology is known as Scrambler therapy is that the messaging, unlike a TENS unit and other things out there, is not a static message. It's sent and it's scrambled in the device and then resent and then scrambled in the device and then resent. And so over about a 40-minute session, the brain is flooded with a dynamic and changing set of information, which it has to work to interpret. If it was unchanging, at some point the brain would probably start to ignore it and say, oh yeah, I've heard this before, background noise, and it would start to dismiss it. Or if you think of it at the analogy that you use, the voice whispering or talking to you versus somebody yelling at you, if the yelling is more dominant, it's going to go back to the yelling, particularly because pain thinks, the nervous system thinks that pain is protecting us. So it's going to go back to that as a default because it wants to protect us. Well, because this is changing, it causes the brain to have to work to interpret that. And that works to break up these wirings or associations or what we call neurotags that are perpetuating the pain experience. And it causes the brain to go through its own natural kind of healing process, if you will, and to create a more normalized, healthy perception of pain. We haven't induced any chemicals, injected anything into the body with a needle or given somebody a drug. We haven't cut anybody open. We've just basically given, going back to your analogy, more information that overrides the yelling that's taking place from a variety of places. And so the brain goes, okay, I can ignore the yelling. The yelling becomes less and less important because now I'm hearing other voices that make more sense to me, and it allows the body to heal and normalize. So we get relief then that becomes durable or lasting through the principle of neuroplasticity. So just like riding a bike or learning algebra or Spanish, over a series of treatments over time, we can cause the brain to change through repetition and exposure, and we get relief that becomes lasting rather than just temporarily masking it.
Yeah, I love that. And I was also trying to think how we would extend it with the analogy. So I guess it's like you're hearing this yelling, this pain, and it's sort of like somebody coming in and being like, no, actually, maybe there's not any yelling going on. And then I guess if it's like scrambling, with the scrambler therapy, you said it's constantly changing. Maybe it's like multiple different people coming in and being like, actually, there's not actually any yelling. And then somebody else coming in and saying, think about it this way. There's not actually any yelling. And then eventually you're not even hearing the yelling because you completely reframed it.
That's a really, really, really great analogy. In fact, I'm going to have to steal it if you don't mind and use it sometimes with our clients.
Okay.
I think it's great. And that's how we work in life too. I mean, if somebody tells us one thing and it's different than what we've heard before, depending on who that person is, we may or may not accept it. But if we start to hear it from multiple people and there becomes more and more social proof for it, then it's like, it's natural that we accept it. It becomes much easier to say, okay, yeah, I agree with that because everybody else is. So there must be some truth to it. And I think that's a very, very good analogy.
Exactly. Yeah. It's like me, whenever I find a new topic that I'm really interested in, I know this is a podcast. I love listening to podcasts as well. I will go and find every single podcast I can find on this new topic. And even if it says the same thing, just because it's coming in through a different person saying it, in a slightly different nuance, I'm like, oh, okay. And it it really ingrains it and makes me have a new perspective. So that completely makes sense to me.
Yeah. And then, what we have, just kind of to bring this full circle and go back to the nutrition stuff, but what we find is, our clients come to us desperate. They feel like they've tried everything. In fact, we've had clients that have taken very drastic procedures after years or a decade in some cases or more, trying to find resolution to their pain, where they've chosen to have a part of their body amputated, trying to cut out the tissue that's painful, trying to have a better quality of life, and on and on and on. And so they come to us skeptical. They come to us exhausted. They come to us obviously in pain still, and frankly, fairly complicated. Over the years of this, they've gained weight. They've withdrawn from the things and people and relationships and jobs that make them feel really fulfilled and productive. And so there's an emotional and oftentimes depressed kind of component to the circumstance of their pain. They're on a cocktail of medications many times. And so to be able to educate them first, and we always talk to each client about their definition of success, their why. And we anchor back into what it is they want to get back to and why that's important to them. And many times they've forgotten about that. They've deviated so far from that. It's just kind of been about survival, that when we start to kind of help them anchor back into that, we get them focused back on who they want to be, it kind of ignites spark that's gone fairly dormant. And then you educate them and hope begins to be returned, because it's like, holy cow, like maybe there is a reason that my body is hurting the way it is. And even though my doctors haven't been able to explain it to me prior, there's science that explains this. This makes sense. And so the hope begins to be rekindled. And so when you have hope rekindled, you have some education that's empowering, and you're focusing where you want to go, the paradigm starts to change. And then we give them the first treatment for free. They can experience some level of relief that accelerates the hope. And then the process begins to unfold. And over a matter of weeks, we see people significantly have their pain reduced, which is obviously the goal. But what also happens is daily, they become more and more empowered to take their life. And it's not just the pendulum swinging back to baseline, but they become hungry to say, oh my gosh, like if I can change my pain reality so much by changing my brain, what else am I capable of? And they get educated and they get empowered and they get, hungry in the pursuit of better nutrition and better mindfulness and better environmental, factors in emotion and relationships. And it begins this cascade of reversing not only the decline they've been into, but kind of a reemerging of a person restored and empowered with tools and resources and education, where they go out and seek the things that are going to make them really start to thrive again in their life. And it's just a phenomenal thing to be a part of on an individual level. And as we grow the company, to think about our ability to make a social impact and start to see this on the scale of hundreds of thousands or millions of people's lives is a very, very exciting thing for me, for sure.
Yes, I love this so much. So like I said, my mom having always struggled with chronic pain, and she doesn't listen to my podcast really, but she might actually listen. She might listen to this episode because I'm going to throw it at her. And when I was reading your book, I was telling her everything, because she had just come to me a few days ago or a few days prior to reading your book. And she was like, I'm, so tired and overwhelmed of treating this chronic pain. She had herniated discs, she's had surgery, everything you were talking about, always dealing with pain pills and things working and then not working and just never having any relief. And she had come to me asking if I knew of any other ways to address chronic pain outside of the pain meds. And so this was right before reading your book, and I was telling her a little bit about red light therapy, which that's a whole tangent, but I'm very passionate about that. And then I read your book and I was like, Mom, this might be the perfect, the next thing for you to try. But actually, I feel pretty confident that this could be very effective. So I was so excited. And then, like you said, I really think it could be a self-fulfilling prophecy, because once you do start making those changes in the brain and having this new experience, imagine just like chronic pain perpetuates itself, I imagine the healing process and the reevaluation would also, imagine just continue to perpetuate and get better and better.
Yeah, absolutely. And I think it's arrogant for anybody to say like this is the be all end all, one solution for every problem out there. I'm not saying that that's what we have. I think that's kind of an arrogant statement to suggest. But I will say that because it doesn't involve drugs or needles or surgery or injections or anything. It's very safe. It's very, very safe. And it's consistently effective. We've been doing this now for 5 years. We've seen many hundreds of patients with almost every type of chronic pain. We average a significant reduction of pain, about an 84%. Most of our clients conclude between 0 and 1, 2, or 3 levels of pain. So even if it's not fully resolved, it's a level of mild pain that most of us can tolerate and live with, where we can't at a 6, 7, 8, 9, 10 level pain. We have the confidence to think and to state that we have a safe and consistently effective therapy. And what we've tried to do with Radiant is to build a business model and to design a model as elegantly as we can to support a good business delivery system and to support greater care. So again, education, the environment that we create. And so rather than selling this device to a doctor and saying, good luck, doc, figure it out, we're building our own clinics. And these clinics allow us to create a higher level of engagement and customer or client experience, if you will. And we have no other drivers. There's no other constraints in our business that are pulling on us in any other way. It's all about how do we deliver the best education, the best experience, and the best therapy that we can. So it's entirely designed from top to bottom to support this therapy. And that allows us to be consistent in the results that we achieve. It also allows us to make it affordable regardless of what happens with insurance now or in the future, and still build a viable company. So now we have affordability, we have economic sensibility, and we have consistency. And those are the necessary things necessary for us to be able to scale and to create replication and to be able to build and grow clinics. And I think the analog to this is Starbucks. If you think about Starbucks and the change they made it for most of us in how we appreciate coffee, the role that it plays in our lives, how much we spend on it, et cetera, they didn't do that by selling a better coffee product to the local mom and pop diner. They did it by creating their own stores, which created an experience and which created a brand and which allowed them to grow the way that they have.
So going a little bit deeper into how your Radiant Relief clinics are set up, what does that process look like for somebody who wanted to undergo the therapy? Like how many sessions? How did the sessions work? You compared it a little bit to a spa membership. Just what does it look like on a practical day-to-day level if somebody were to start engaging in this therapy?
Yeah, well, the experience starts before they even come into the clinic. It starts with education. It starts with understanding, some level of insight into the brain's involvement in the pain, and at least some hope that we have an approach that's going to be much more safe and effective than what they've tried in the past. We then ask clients again, what is your definition of success? What does pain cost you? What are you hoping to achieve? Why now? These types of questions that get them thinking and framing the context around their pain a little bit differently. It's very safe. So unless somebody is pregnant or has an implanted medical device like a pacemaker or something, we can treat them. And so there's a very low barrier. We don't charge anything for the initial consultation, which is an hour of education and, kind of engagement with the client to understand them and their perspective on it and share with them the modern pain science and our approach to it and the process that the therapy kind of requires, and then to treat them. So we give every client, unless they're disqualified because they're pregnant or have a pacemaker or something, we give them 2 hours of our time. And so that is different than what happens in most places, to begin with. And again, it's all kind of focusing back on them and their why and how we can help them get there. We then treat them. And in that process, people get, pretty much some level of relief in that first session to get a sense that this is something that's worth pursuing. We sell the therapy on a membership because it really is a process, not a procedure. The process of brain retraining is one that's done over repetition and exposure over time. So typically for most clients, the expectation we set is that it's going to be a daily session for about an hour of their time. It's about 40 minutes actually on the device, but between changing and getting into a gown if necessary, or just checking in and that whatnot, it's about an hour of their time. So every day, for an hour, 2 or 3 weeks, Monday through Friday, in most cases, we'll achieve significant reduction in pain that becomes lasting on average for a few weeks or a few months, but in some cases even longer, including indefinitely. But the expectation we set is daily sessions for a few weeks. You will likely need to come back in periodically for what we call a booster session, which is kind of like a refresher course to reinforce the neuroplastic change that's taking place in the brain. And we sell it on this membership, which allows us to push the cost out over time, making it much more affordable despite a lack of insurance coverage at this time, and allowing clients to have access to it throughout the year so they can get relief, they can maintain it. And then what happens is not only are they back to living their lives and, like I said, becoming less and less complicated and empowered to make other changes, if pain begins to return because of this prior experience they had that caused them to come in initially, or something else that happens, because pain is very human, we all have it, they're not in this place where they feel a loss of control. They feel empowered. They know, okay, even if I have to go back into Radiant, I have a tool that I can go back to that, it's not going to knock me down the way that it once would have in the past.
Yeah, no, I think that's a really wonderful model to have, the membership model versus the a la carte basis, because it just really provides that access to, get the process going without the stress of, how many sessions do I need, and what if I need more in the future? And yeah, that makes a lot of sense to me.
We try to make it obviously as affordable as possible. I mean, by spreading that over time. Our membership starts at $3,500, which includes 20 sessions that they can use throughout the year. Once they paid for membership, the cost for additional sessions beyond 20 is discounted pretty significantly versus paying a la carte. So we try to make it affordable. Obviously, we try to create as much value by educating people about what we do and giving them some initial free treatment and education, which is for many people, like I said, very empowering, to the point where it's not uncommon to see tears of hope and tears of joy just in that first consultation, because people go, oh my gosh, like maybe I'm not going to be, jailed in this body that's betraying me and hurting me for no explicit reason for the rest of my life. And the truth is, because pain is such a complicated and difficult thing to live with, and because people haven't got the answers or the resolution of their pain the way they've hoped to previously, many of our clients tell us they've thought about suicide, which is just so unfortunate. And so again, to be able to see people get their lives back and get restored is a beautiful, beautiful thing. And, we're not here to bamboozle people. There is a cost to it. We have to build a business so that we can scale it and deliver it to more and more people. But at $3,500, you divide that by 365 days in a year, it's less than $10 a day. So for around $10 a day, for what many of us spend on a couple cups of coffee or lattes or whatever, we can give people their lives back. And it's pretty cool.
Yeah. From a grand perspective, I think that's a very worthy and even small investment if you're getting your life back. You can become a whole new person if you don't have this. Like you said, it's like being let out of jail in a way, and not having this issue that defines every moment of your life. That was something that also resonated with me in the book. You were talking about how pain can so easily become part of our identity. There's the chronic pain aspect, and there's also the identity aspect about how it can just become all encompassing.
Yeah, it's both tragic and interesting. I mean, pain, because we hurt, it makes it harder to stay stay plugged into the relationships or the work or the hobbies or activities or whatever it might be. And that's hard. And there are, and I'm not here necessarily to place judgment on this, but to point it out as a reality. There are some people that while they say they want to get out of pain, they use their pain as a shield, as a reason to not face other things in their life that probably are priorities and may actually be contributing factors to their pain experience. I mean, they could be things that their nervous system is perceiving as a threat. They're not ready or willing to go there. And I'm not here to place judgment on that, but our process is designed to kind of filter those people out and to focus on the people who are really ready to reclaim their lives first. And that way we're able to deliver as much value to those people as much as possible. And as this becomes more socially accepted, as the education curve evolves, then, those people right now who are the early adopters we're treating, and those that become, more open to it as time goes on, or circumstances change in their life. So they're like, okay, I really need to address this in a different way. We'll be ready for them at that point too.
And what are you seeing as far as success rates go with your therapy. Are you doing any clinical trials, by the way, or how's that looking?
We're a consumer business, so we're not necessarily doing our own studies, but there has been research at the Mayo Clinic and Johns Hopkins and a few other notable institutions, and most of those results have been pretty impressive. However, our results on average are even better because this is the only horse that we've been riding. We've really learned a level of clinical efficacy and acumen, and again, we've created a business structure that supports better clinical results. And so, I think head to head, even if somebody else has this or the institutions like the Mayo Clinic or Johns Hopkins that have been researching it, our results by and large are more consistently effective. We average about an 84% reduction in pain across the board, which is life-changing results. I mean, some of our clients, when we ask them, what is your definition of success? They're like, man, if I could get a 50% reduction in pain and just kind of somewhat tolerate, get through the day a little bit easier, that would make a big difference for me. And so to average, a significant reduction like 80+% is literally life-changing and life-saving for most of our clients. And even though pain is experienced in many areas of the body and there's different diagnoses and there's different contributors to why they've had that pain happen, the commonality is the brain. And so generally speaking, we're pretty effective across the board at almost all types of chronic pain.
Yeah, so that was something, bringing it back around to my own selfish question. So like I said, I don't have pain specifically like chronic pain, but this is something I was actually asking you about. Could this concept in a way be applied to other issues? Like I said, with like people with IBS or something where they might become hypersensitized to sensations in their gut, for example, because I know we see in clinical studies that a lot of people with quote IBS, they do studies and they realize that these people are actually experiencing more sensations than a person without IBS would have. So I know that's a tangent, but like, could this concept be applied to something like that, do you think?
I think in theory, absolutely. I mean, I think you look at conditions like IBS, you look at something like tinnitus, which is ringing in the ear. I mean, you look at anxiety. There is a case to be made that this approach could be effective for a lot of different conditions. And so, yeah, I think yes. The appropriate answer for me to say is without further, studies and evidence, we don't know. Anecdotally, we've seen a variety of people. We have treated people with IBS and we've seen some good results in many of their cases, not as consistently effective as just a pure pain, but there may be other factors that are playing into that too. And, that's not necessarily our area of expertise. So, and we haven't had enough client volume to really give an accurate insight into that, if you will. Even things like, for example, we were treating an older gentleman in his late 70s. He'd been experiencing pretty profound pain in his shoulder, frozen shoulder, and a variety of other things. And he was also a dementia sufferer. His wife would bring him in for treatment, and we always try to include the spouse or family or companions in the process of care for a variety of reasons. I think it helps the outcomes, it helps the expectations, it helps, bring clarity to it. The wife would say she noticed that he was not only complaining less about the pain, but it seemed like he was more present, like the dementia symptoms were a little bit eased. And, it's an N of one. It's not necessarily a study. It's totally anecdotal, but it is interesting. And there are studies that show when somebody is in chronic pain, the brain lights up differently. And parts of the brain that are, like our ancestral brains, are the limbic brain, the brain stem, these more ancestral anatomy functions of the brain are what are driving chronic pain initially. And when someone's in chronic pain, it makes it harder to be a sensitive person. It makes it harder to feel the nuances of life and certainly the joys of life. And so, I think it's possible in theory for this to become a catalyst for many other things. And I often joke, particularly with my functional medicine friends, that I look at us as the gateway non-drug. The average person out there may not care about what they eat. They may not care about their mindset or their environment or their sleep or their movement. They're just trying to survive. They're just getting through the day and they're happy to just kind of keep doing that. But a chronic pain sufferer is motivated, particularly one that feels like they've exhausted their resources. They're desperate to feel better. And it's a huge population. So we have an entry point to the populace that's significant and that's desperately seeking something that's safer and better like we have. And as we educate them, it does become this catalyst for change. And so, who knows if this could be something that in the next 5 to 10 years, if it takes off the way that we hope it does, that it could be something that has really fundamentally not only just changed the way we think about and treat pain, but has been a catalyst for how we approach our brains and our minds and a variety of other things related to overall health.
Wow. Yeah, I am so motivated and encouraged by this, just like for my mom personally. And then I'm just like thinking so much about, like I said, my own thing. It's not chronic pain, but it's really interesting because so about like 4 years ago or so, I think I pulled a muscle from an ab exercise because that's when like the next day I had pain from it. But ever since then, that area would always seemingly flare up with my digestive issues. And so I was like convinced that it was a digestion issue, not like a sprained muscle or something like that would typically manifest as pain, because it wouldn't manifest as pain. It would manifest as just like a feeling or a pressure. And then I would see different practitioners and they would tell me, actually, it's kind of like we were talking about with the Scrambler therapy, people coming in and telling you to reevaluate or rethink something. They would say, actually, this isn't digestion. This is from a pulled muscle. And I remember the first time I heard that, I was like, no, it's digestion. But then another practitioner said the exact same thing. They were like, no, this is the muscle that's pulled. So I started thinking about it more and more. And then that's why I really resonated with this. And I was like, oh, wow. So maybe this is this concept of, a signal constantly being set off by pressure or digestion or something like that. And my brain registering it, reading it as, in my case, just a sensation that's related to digestion when really, maybe it wasn't even that at all. And like I said, that was like 4 years ago. And I think it's crazy that you could still have a sensation from something 4 years later. But that's something else you talk about in the book, that, people have these injuries and some people heal right away seemingly, and other people it turns into this chronic pain monster.
Yeah, right. So obviously the tissue in 4 years would have healed. I mean, it typically will heal in a matter of a few weeks or a few months in most cases. So essentially what's happened is, there's a phantom pain happening in your abdomen. Why it's happening, nobody can, fully understand. But we do know that all pain is neurogenic. It's coming from the brain. And the brain has created this kind of area, this little map there in your abdomen that says this is an area of vulnerability or pain, and it's kind of making you always kind of hyper aware of it so that you're going to protect it, I guess, if you will. But it doesn't necessarily need that anymore, and we could probably, through our therapy, help resolve that and cause it to go away. Versus, what many people do again is pop the pill, and then they have further gut problems because their body's not absorbing nutrition and eliminating waste, and it just becomes an exacerbated problem over years. So I know you haven't gone down that path because you've been so educated about nutrition and made much better choices than most of us probably would have. So congratulations on that. It hasn't probably made that worse, but I think that's the type of thing that we could definitely help for sure.
Well, that's the thing. It's funny that you touched on that. That's what also really resonated with me, is because I still have like these issues with this feeling and the digestion, and people will say to me, they'll say, oh, it's not fair because you're doing everything, quote, right with diet and everything, but it's not going away. I don't know, just having this new mindset and this new reframing, reading your work for me personally, and then pain in general, it really adds a nice new perspective to things. So I really, really thank you for that. So for listeners, if people are interested in, trying this therapy, what is the situation right now with your pain centers? Are they in different locations? How can listeners find out more information? What's the plan there?
Yeah, well, we are right now only in Portland, Oregon. We're working on a few different growth strategies, one of which I can't disclose yet, but it's going to be very exciting. But in the shorter term, we want to create as much awareness and interest around what we're doing as possible, because I think education and hope precede the ability to really make inroads and kind of shift society anyway, which is why I wrote the book, because even if I had all the capital in the world, I can't open clinics overnight. It takes time. And so the book is a way to kind of lead the market and educate people about it. So I'm honored to be on the podcast and to share the story, and really appreciate that. But we rather than coming in and acting like the people that know everything, we want to create an opportunity for everybody to get involved and get engaged. So from a consumer standpoint, again, we give the first treatment for free. And even though we're in Portland, we do have people that fly to us from all over the country and even out of the country to spend some time with us and to get treatment. If you're local in the Oregon, Portland area, it certainly makes coming in a no-brainer, because other than a little bit of time, there's no obstacle to that. But we hope to be able to grow and open more centers across the country. In addition to the free treatment, we have some other things that are happening in terms of online education and some tools that may be helpful for people. So you can, go to our website and kind of sign up and follow us along there. We also filed with the SEC to begin essentially it's a crowd-funded public offering. And once we're approved by that, hopefully very soon, anybody, you don't have to be a rich accredited investor, anybody for whom this is a relevant problem or of interest can invest as little as $500. And then as we have, hopefully thousands and thousands of people saying, wow, this is cool, I'd like to be part of this, they invest smaller amounts of money, we aggregate a lot of capital, and that allows us to grow much faster and simultaneously create interest and engagement with the audience, with the consumers in the market that are interested in this anyway. And then our business model, instead of selling a device to a doctor, which is quite costly, and saying, good luck, figure it out, is to give them an opportunity to invest in a local center at a much lower cost than what even a single unit cost of a device is, and have economic participation that's compliant with Stark laws and anti-kickback laws that regulate physicians and clinicians, and in a way that's completely passive. So we build the clinic, we operate it, we use their capital to do it, so that allows us to grow faster because we're using their money versus ours. And we create relationships in the market so they can refer to us and we can refer back to them when it makes sense. And they don't have to become experts in our therapy or take time out of their busy lives to try to figure out how do they integrate this into their world. So those are the things that are evolving that will allow us to grow. And then the third is, as I mentioned, something that I can't quite disclose yet, but hopefully that comes out in the next few months. And if that happens the way we think that it will, this will allow us to grow even much more quickly and reach a lot more people to help them. But if any of this is of interest, please reach out and, go to our website and say, contact me, and we'll keep in touch.
Yeah, so for listeners, that website is radiantrelief.com. You've also got radiantpainrelief.com. And I will put links to everything in the show notes. So the show notes will be at melanieavalon.com/radiantrelief. So I'll put links there to the website, to all of the social media handles. And also you are offering our listeners a free digital copy of your book. So thank you so much for that. And that will be available if you go to radiantpainrelief.com/free-book. So again, that's radiantpainrelief.com/free-book. And I will put links to that in the show notes as well. I do have one more last question for you, Brendon. So this is something I like to ask as the last question for everybody. And it's just because I've realized how important mindset is just in everything in life. So I want to ask you, what is something that you're grateful for?
Boy, I'm grateful for the opportunity to be the one that gets to help bring this new approach to market. It's a lot of work, to build a company in any circumstance. It can be a very lonely process and a very discouraging process sometimes, and it certainly has been for me. And so I've invested very heavily in personal development and managing my mindset and approaching my day and my week and my month and my year and my vision from this perspective of taking ownership for that. And, it's easy to feel like, oh my gosh, it's so hard. Where am I going to raise the next round of funding to, cover payroll or to meet, some growth expectations or whatever, and to feel discouraged by that. But the truth is, I am very grateful that I get the opportunity to do that. And to see people get their lives back and to think about the idea that this could be something that grows in the coming years and literally can reach and impact millions of people for the better is very exciting. So I'm grateful for that. And, and if you were to ask me what is one recommendation to any pain sufferer out there, it's the same thing. It's focus on what you're grateful for, because pain robs us of that sense of gratitude. It robs us of the things that we really love, including just normal life. And if we can focus on the things that we still have in our lives to be grateful for, it helps shift the perspective of the mind. And it does change the chemistry of the brain, and it changes the chemistry of the body, which could result in less pain. So it's an interesting phenomenon. And I'm honored to have been on the podcast and to share the story. Thank you so much.
No, of course. Yeah, I love that so much. I remember when I learned that we could not be in a state of gratitude and a state of fear simultaneously. And it's kind of like we were talking about with, this fear and anxiety and this miswiring of the brain. So it completely makes sense that cultivating this mindset of gratitude can really, really be a wonderful thing. In addition, and thank you so much for everything that you're doing. I'm ecstatic about these new developments, and I eagerly await seeing how everything goes. And I really wish I was in Oregon right now, me and my mom.
Well, come hang out. I apologize, we're not closer yet, but we're working on it. The next expansion market is expected to be Boston. Probably by the end of summer, we'll be open there. Still not so close, but at least on the East Coast. And then we'll just continue to grow as quickly as we can thereafter.
Awesome. Well, I wish you the best with that. And I'm sure wonderful big things are coming with everything.
Thank you. Thank you so much.
Thank you so much. Thank you so much for listening to the Melanie Avalon Biohacking Podcast. For more information, you can check out my book, What When Wine? Lose weight and feel great with paleo-style meals, intermittent fasting, and wine, as well as my blog, melanieavalon.com. Feel free to contact me at podcast@melanieavalon.com. And always remember, you got it.